second step in being prepared is to prepare an emergency kit. This kit should be in one backpack and ready for you to grab and go, along with your all-important binder in case you're evacuated in a hurry. Larger facilities should keep a backpack for each group with emergency supplies for the children involved. These packs ought to include copies of each child's emergency cards and their family emergency plans provided by their parents. They should also be packed with necessary medication, such as insulin or EpiPens, first aid supplies, sanitary items, flashlights, portable radios, and batteries. It's also a good idea to store emergency supplies in your designated safe room. Copies of the children's emergency contact cards, a first aid kit, blankets, a battery-powered radio, flashlights, and extra batteries. And don't forget personal hygiene and sanitation supplies like toilet paper, paper towels, diapers, wipes, and plastic bags. You'll also want to have enough non-perishable food and water to last the staff and children for at least 72 hours. That's 1 gallon of water per day per person. This really should be commercial bottled drinking water and should be replenished at least once a year to keep it fresh. When it comes to the non-perishable food, consider food allergies and keep a supply of disposable bowls and utensils, along with a manual can opener. You may even want to include coloring books, puzzles, or other fun items to keep the kids busy and keep their minds off the crisis at hand. Also think about asking parents to send individual emergency packs to keep at school that include a change of clothes, blanket, one-day supply of diapers, one-day supply of formula, and a few family photos to help comfort their child in a crisis. These individual packs should all be kept in the safe room with the rest of the emergency kit supplies. In general, you should have carbon monoxide detectors in addition to the required smoke detectors, and be sure to check them often. Ensure that fire extinguishers are properly charged and easy to reach. You might even consider having a licensed electrician install a generator for backup power. The final step to being ready in 3 is to listen for information. You can trust that our public officials have plans in place for these types of situations and are monitoring our safety 24/7.
No matter what situation occurs or where it takes place in the state of Missouri, you can rest assured that the state is ready and waiting at all times. The DHSS Department Situation Room is the central location for monitoring and reporting potential problems 24 hours a day, 7 days a week. All local public health agencies, doctors, hospitals, and law enforcement know to call the emergency hotline anytime if they suspect there is a public health emergency or bioterrorism event. This computer system tracks the emergency rooms in hospitals all across the state, and folks here are constantly monitoring many different things, ready to determine when they have an emergency on their hands. Should a crisis arise, Missouri's Department of Health and Senior Services works with the FBI, Homeland Security, the State Emergency Management Agency, local police, and others, including the governor, to determine the best response. The state of Missouri has plans in place for all types of crises, and state officials have conducted many practice drills for everything from chemical spills to lots of people getting sick and needing medicine at one time. But no matter what type of emergency, a few things stay the same. The experts here always work with state and local law enforcement and also notify TV, radio stations, and newspapers.
CSR to OPI, over.
That's why it's important for everyone to listen for instructions.
It's good to know that local, state, and federal agencies have plans to protect and inform us all, but it is up to you to listen and respond. Equally important is your willingness to listen to the children in your care. Unfamiliar places, first responders, and activity that is not routine for them may scare the little ones, so closely monitor their behavior during an emergency and during practice drills, and watch for the following signs of stress.
Children are overall amazingly resilient, and most kids do quite well. However, there are some red flags to look for. These can include things like clinginess or increased dependency on a trusting adult, anxiety about separating from adults. To some extent, responses depend on the child's age and developmental level, but probably the strongest predictor is sort of how they're doing before the emergency or before the emergency preparation can tell you a lot about how they're likely to do during that phase. So if it's a particularly anxious child who has difficulty dealing with disruptions or change, or somebody who has developmental issues or sensory sensitivities, these are just things that are going to be exacerbated during the time of a crisis. Anything that looks monster-like, in particular masks, are threatening to young children. I've heard people refer to the firefighters' oxygen masks as Darth Vader-like, and so therefore we suggest allowing the child to see that kind of equipment in advance, to even touch it, manipulate it, and perhaps even put it on. Children really are going to have lots of questions about what is going to happen to me and who's going to take care of me. So being able to say, we have a plan for trying to get you back home or get you back in touch with your parents, the extent to which, again, there are strategies in place is very comforting for the child.
Parents will be the best source of information on their child's likely reaction to a crisis. So again, it is important to discuss emergency preparedness with families. And remember, children are taking their lead from you and your staff. If you remain calm, so will they. Thinking and planning ahead is the best line of defense for any emergency. Take an active role in the safety of the children in your care by creating a plan, preparing a kit, and listening for information. And once you do, be sure to check your plan and your kit every now and then to make sure everything is still good. It's also important for you to encourage parents and your staff to create their own family emergency plans. DHSS will be happy to send you copies of the Missouri Family Safety Guide and Family Plan to share with them. After all, the more prepared they are, the smoother things will go during a crisis at your facility. It's also a good idea to meet with your neighbors to determine how you could help each other in an emergency. And start developing personal relationships with local emergency officials, law enforcement, and public works personnel. These are the people who will likely respond to an emergency at or near your facility, and they can help you determine possible hazards or threats in your area. You may even be able to offer your services as an emergency shelter for others in need, or as a last-minute childcare option for emergency responders. Communication is the key to crisis control before, during, and after a disaster. So start immediately by sharing your plans with staff and parents too. In fact, showing that you are prepared will likely make you more marketable as a child care provider. It will certainly decrease your recovery times should disaster actually strike. But most importantly, it can save lives. So remember to stay alert, because emergencies can happen anytime, anywhere. But you are only 3 easy steps away from being ready in 3.